This video should be used in conjunction with the patient data information sheet on colonoscopy which you've also received. What is a colonoscopy? A colonoscopy is a medical procedure performed by trained doctors or nurses to investigate a patient's bowel. Through the use of a colonoscope, which is inserted through the back passage of a patient, a small light and camera located on the tip of the flexible scope allows the doctor to see inside the patient's bowel. What are the risks involved? Complications such as bleeding, infection or damage to the bowel in this procedure are extremely rare. Sometimes, abnormalities are missed, but this is usually due to the bowel not being completely clear as a result of poor bowel prep. Patients may receive sedation but will still be conscious during the procedure.
If you plan to have sedation, ensure that someone can pick you up from the hospital and stay with you overnight, as the sedation will continue to have some effect on you for up to 24 hours.
The procedure usually lasts 30 minutes, but you should expect to be in a department for up to 3 hours. Colonoscopies are performed when a patient is troubled by certain symptoms or may be at risk of developing diseases of the bowel. Polyps are overgrowths of tissue which are commonly seen in the bowel. When found, they are usually removed to prevent them causing problems in the future. So, what must a patient do to prep for a colonoscopy? Your doctor encourages you to pay close attention to the following instructions and the written information sheet that has been provided. If the prep is inadequate, an abnormality may be missed, or you may even need to come back on another day to repeat the procedure. Do it once, do it right. Prior to your test, your bowel is cleared by a drink called MoviPrep. For your bowel to be best prepared for the test, you should follow the diet instructions and fully drink the MoviPrep at the recommended times.
The day before your procedure, do not eat anything after 1 p.m. if your procedure is the following morning or afternoon, or 9 p.m. if it is the following evening. However, clear fluid is allowed.
A low-fibre diet leads to a better prepped bowel. The following diet should be consumed for at least 1 day prior to your procedure. You will receive 1 box of MoviPrep which contains 2 full doses of bowel prep in 2 separate sealed bags. Each bag contains 2 sachets, A and B, which when mixed with 1 litre of lukewarm water forms 1 dose of MoviPrep solution. Stir until the powder has completely dissolved before drinking. For a morning appointment, the solution should be made up and drank at 5 p.m. and 8 p.m. the evening before your procedure. If you have an afternoon appointment, you should make up and drink the solution at 7 p.m. the evening before and 6 a.m. the morning of the procedure.
And if you have an evening appointment, the solution should be made up and drank at 7 a.m. and 10 a.m. the day of your procedure.
Do not eat anything on the day of your procedure until after you've had your colonoscopy.
You should try and drink 250 millilitres of the prep every 15 minutes. Feel free to mix the MoviPrep with cordial, cool it in the fridge, or drink it through a straw to make it easier. The MoviPrep solution can taste unpleasant, but it is important that you finish the whole litre. MoviPrep will continue to have an effect for 2 hours after you complete it. MoviPrep is designed to flush out your bowel so that the doctor or nurse can investigate it thoroughly. So, it may be a good idea to keep close to your toilet. Ensure you drink plenty of fluid as the prep can cause you to become dehydrated. Try to drink at least half a litre of clear fluids after finishing the MoviPrep solution. It is key that you follow the consumption instructions carefully so that you only have to do this procedure once. What if the patient is on medication? Most medication may be continued as usual, however, it should be taken an hour before or after the MoviPrep solution is consumed. If you are diabetic or take medications that thin your blood or cause constipation, please consult the patient information sheet for further information. If you have any problems or queries, feel free to ring your endoscopy department or dial 111 for out-of-hours advice.